Road, and Lane Wiley Senior Center located at 6710 Wiley Road. As a reminder, because of limited availability of this vaccine, Governor DeSantis has prioritized its distribution for those at most risk. At this time, the vaccine is only available for individuals 65 and older, frontline medical workers, and first responders. The vaccines at these two locations are for Duval County residents only, ages 65 and older, and they will be on a first-come, first-served basis. While you will not need to register prior to coming to these two sites, but to avoid large crowds, we will require that eligible patients come to these sites on the days associated with their birth month. Please follow these procedures strictly. We're doing this given the problems that the health department and others have had because of overloaded phone lines, online scheduling. At this time, we're asking people to come on days associated with their birth month. There's a possibility we may have to adapt and change, but this is the method we're going to use now to make sure that people can get in a smooth and efficient way. Monday is reserved for January and February birthdays. Monday is reserved for January and February birthdays. Tuesdays for March and April. Tuesdays for March and April. Wednesdays for May and June. Again, Wednesdays for May and June. Thursdays for July and August. Thursdays for July and August. Fridays for September and October. Fridays for September and October. And Saturdays will be for November and December. Please follow these guidelines. Strictly follow them. The Mandarin Senior Center will provide 500 vaccines per day. The Lane Wiley Senior Center will provide 475 for a total of just under 1,000 vaccines per day. The vaccine that's being distributed at both sites is the Pfizer vaccine, which now appears to work against a key mutation in the highly transmissible new variants of the coronavirus. Again, these two new sites will operate differently than the Prime Osborne facility, which is run by the Florida Department of Health. As I mentioned, the Lane Wiley Senior Center and the Mandarin Senior Center are a first-come, first-served basis each day based on the birthdays and days I laid out before. The staff at these sites will identify when they are close to reaching that number and will ask those who did not make the daily cut to please return on their designated day the following week or to try to get an appointment with the Florida Department of Health's Prime Osborne Convention Center vaccination location. To talk more about the qualifications and what you will need to fill out and bring with prior to receiving a vaccination, I'm turning the mic over to Dr. Charles Moreland, who has been instrumental in creating and operating our COVID-19 testing program, and now is helping lead the charge with this vaccination program as well. Dr. Moreland, thank you for being here.
Thank you, Mayor Curry. It is a pleasure to serve our community throughout this crisis. In order to keep the vaccination process at these two centers running smoothly, I want to review the requirements and tell everyone how to access this form. This is the vaccination screening and consent form. Which will need to be brought to the location on your assigned day. Everyone must bring a photo ID that shows your date of birth and prove Duval County residency. You must bring a photo ID and work ID badge if you are a first responder or healthcare provider. Sites will be open Monday through Saturday from 11 a.m. to 7 p.m. Those wishing to get a vaccine should be in line no later than 6 p.m. Masks must be worn at all times and social distancing will be required. Overnight parking or waiting in line overnight will not be permitted. Restrooms are available only for those receiving the vaccine. That brings us to our next request. Only those receiving a vaccine should come to the site. Family members not eligible to receive the vaccine should stay home unless they are a caretaker and the person receiving the vaccine requires assistance. Finally, anyone receiving the vaccine needs to go to www.coj.net/COVID vaccine form. all one word. Please print and complete this form and bring it with you on your assigned day. Thank you again for adhering to these guidelines. Back to you, Mayor.
Thank you, Dr. Moreland. Now to talk about traffic patterns, parking, and other logistics for these sites, I will introduce Chief Matt Namath from the Jacksonville Sheriff's Office. Thank you for being with us. Chief, he's unmuted. Should be good to go, Chief. You're unmuted. We'll try to come back to the chief, and now we will go to the medical director for Jacksonville Fire and Rescue Department, Dr. Brad Elias, to talk a little bit more about the procedure after receiving the vaccine. Dr. Elias, thank you for being with us.
Thank you, Mayor. After receiving the vaccine, there will be a mandatory observation period for a minimum of 15 minutes for anyone receiving the vaccine. This is so our medical professionals and first responders can monitor for any potential reactions. Some individuals may be required to wait an additional 15 minutes, or 30 minutes total, based on their medical history. While allergic reactions to the COVID-19 vaccination are very rare, we are doing this out of an abundance of caution and for the safety of our citizens. The waiting area will be sanitized and you will be socially distanced while you wait. Please make sure you bring your mask and wear it during your time in the center. In the event of a medical emergency, each vaccination location will have an advanced practitioner, multiple first responders, and a dedicated rescue unit on site. I'll be happy to answer any questions at the end of the press conference. Thank you, Mayor.
Thank you, Doctor. We are having technological issues getting Chief Matt Namath on to talk about traffic patterns. You can get it at jaxready.com. We will also get those maps and traffic patterns out to all of the news outlets so you can provide that to your viewers and all of the people of Jacksonville. Please, when this comes out, pay attention because traffic flow and access will be very important as we follow all these procedures. Thank you for your patience in dealing with these technical difficulties. Before we go to questions, I want to remind folks to continue to engage in the same safe practices we've been doing for the past year. Wear a mask when you can't socially distance indoors, hand wash, social distance, and all the things and precautions we've been taking. Until most of us can get this vaccine, personal responsibility remains our greatest tool in combating the spread of this virus. So please continue to do your part. I would remind people that we are experiencing spread now. When we experienced this summer, we said that as long as it's with us, the spread is real. So let's be responsible, let's be smart, and let's take the necessary precautions. With that, we're available for questions. Raise your hand, please. There don't appear to be any questions. Again, I want to stress procedure, and I understand that people have been frustrated with access to the vaccine. I want to remind folks, we don't control the supply chain. The state of Florida doesn't control the supply chain. It's a large, federally coordinated effort for all of the states and all of the cities. We're one of many, but we're working hard to secure what we can. And as the rollout last week, the struggles that some folks faced with trying to dial into the Department of Health and then trying to go online, we are trying this, which is based on birthday and days of the week. So please adhere to this. Please be strict about it. And if we have to adapt, we will, to make sure that you can get the vaccine. We actually do have a question, Jen, from News4Jax.
Hi, Mayor. Will you cut off the line if there are more people waiting in line when the doors open on Monday than the number of doses that you have available? And also, a side question, do you have any comment on Monday?
I'm sorry, what was the second part of the question?
Do you have any comment on Lot J?
First, I'll answer the first part of the question. There could be people in line that aren't eligible. So the line will be cut off once the supplies don't exist for the day. This is why it's really important that people show up that are eligible, show up based on their age, show up with the proper documentation, and show up based on their date of birth and the day. As far as Lot J, I'm grateful for the work that my negotiating team did, working with the organization leading up to this. We rolled out the first phase of this deal over a year ago, and then the final phase in recent months. The City Council has done hard work on it. We saw hours of work yesterday. I'm grateful for their work, and I look forward to the next steps, which will be next Tuesday, to implement this visionary project that will fundamentally transform downtown Jacksonville. Robert with Action News.
Hey, Mayor. Thanks for taking our questions. We talked to the Director of Emergency Management, Jared Maskowitz, for the state. He said so far in Duval County, we've only been giving out about 10% of the allotted vaccines that Duval has. What is leading up to the supply-demand problem, and why is that number so low compared to what we have allotted?
So I can speak for the access that we have. The vaccine supply chain runs through the state and then runs through the counties, starts with health departments. I've worked directly with Jared Moskowitz. He's been a great partner. We've been on the phone numerous times over the holiday, as recently as the last couple of days. In fact, he is the one that helped the city secure vaccines for these centers that we're opening. That's what we control. The stuff that I announced today are the vaccines that the city controls because of the help of Director Moskowitz getting us those vaccines from the Department of Health to the city so we can help deploy that. The other sites are controlled by the Florida Department of Health. But let me say this. We are all in this together. Department of Health is doing what they can in conjunction with the state. The city has taken what's been allotted to us, and we are going to operate efficiently and get this to people. But we need to be in this together for this solution, just like we were in this together when COVID started in March. And we all stuck together, and we all did everything we can to protect each other. So let's work together, either to come to a city site and get it distributed or work for the Florida Department of Health, and we will continue to work with them and our partners to make this as efficient as possible as the days and weeks go on. We've got a long road ahead of us, but there's a light shining at the end of the tunnel right now. David with the Florida Times-Union.
Yeah, if I could ask a follow-up on Lot J, there were some concerns raised by council members just about the size of the amount of debt the city will take on for that project and whether it's going to make it difficult to do other projects in neighborhoods throughout the city. What is your view in terms of whether this does lock in or hamstring the city's ability to do other projects elsewhere that have been needed and wanted by residents throughout Jacksonville?
Thanks for your question, David. I'm not concerned. My administration and the council before this one and now this one have been incredibly responsible. As you know, we implemented pension reform, my second year in office, which freed up hundreds of millions of dollars a year in our budgets to invest in our neighborhoods. The infrastructure investments we've made since I've been in office with our city council would not have been possible without pension reform. Not only have we made investments in our neighborhoods, we have increased our reserves over the years. We have adequate reserves to handle a crisis or emergency like we have with hurricanes and like we are now with COVID-19. We've paid down debt since I've been in office, significant debt. Every budget that I've presented, it's been a requirement that we pay down debt. So we can handle Lot J, and we can continue to invest in our neighborhoods in a responsible way. In fact, I'm working with a couple of council members now on some infrastructure projects, much needed neglected infrastructure projects that were promised way back as we led toward consolidation. So as we finalize those plans, stay tuned. We are going to invest in all of Jacksonville without burdening the city in the future. Robert with Action News.
Yeah, Mayor, thank you. As you mentioned earlier, cases, are on the rise. Just yesterday, the state seeing another overall increase in cases there. Testing is still so key As you transform these sites into vaccine sites, how are you going to ensure the city still has testing capacity as well?
Yeah, fair question, but we watch this day to day, and there's plenty of testing capacity. We've had days and weeks where there's been very little demand, so there's plenty of access for testing right now. Should that change, we'll adapt as we have through the whole process. The city of Jacksonville, the people that have worked in my office to put together testing, put together stimulus check distribution, to put together the things that we've done in COVID-19, are ready and prepared to expand if we have to. At this point, we have testing capacity and will adapt as needed. I am on regular calls, regular communication with the leaders of our hospital systems. We are all coordinated and in this together. Jen with News for Jax.
Mayor, how many doses of the vaccine has the city received so far?
I have a number in my head, but I don't have it in front of me, so I don't want to give you an inaccurate number. So we will get that to you as soon as we get off of this news conference.
Right now, we're scheduled for almost 1,000 a day at those two sites.
We're scheduled for 1,000 a day at those two sites. Now, that isn't the commitment we have. So we have a commitment that's larger than that, which I'll have to get to you. And that commitment is being allotted to us on a daily basis, which is 1,000 per day. But we will get that to you as soon as this press conference is over. I think I know what it is, but I don't want to misspeak. This information is too important. Thank you very much. Be safe, be responsible, and let's go into 2021 taking care of each other and battling COVID-19. God bless you.